go. Okay, hi, my name is Valley, and we're going to be doing my wound care assessment today. So the first thing I'm going to do is make sure I have all my supplies. I have my dressing tray, changing tray, my measuring tape, the Q-tip, sterile gloves, and a little chuck. So what we're first going to do is I'm going to come in to the patient's room. Hi Bob, my name is Valley, and I'm going to be your nurse today. So what we're going to be doing today is we're going to be doing wound care on you, and I'm going to provide some privacy by shutting the curtains, shutting the door, and everything. So if you would have any pain, I would have obviously have checked it like about 30 minutes to an hour before and made sure it was kicked in, but he says he doesn't have any pain. So the first thing we're going to do is we're going to, geez, just a minute, we're going to move this up to a comfortable working height. I'm tall, so it takes a minute. This is pretty comfortable for me, so the first thing I'm going to do is put on some gloves. These are what I'm going to need to start with. Move these closer to me. These are not sterile gloves since we're just removing the dressing, and then we're going to measure it, so we can do that without sterile gloves. I could get them on. Okay, and then I'm going to put this chuck under his leg. Actually, we're going to wait to do that until we have our sterile felt ready. Okay, decided. Okay, so now the first thing I'm going to do is I'm going to remove this. Okay, so there is just a small amount of serosanguinous on here. The wound looks pretty good. It's a little red and stuff, but it looks all right. So we're going to put this in here. Now what I'm going to do is remove my gloves again because I just touched the dirty surface. I'm just going to use the non-sterile gloves once again. If you put these on, please. Okay. Okay. Now I'm first going to get this. Struggling with my gloves on. Okay. I'm going to try to keep this open and careful. Very careful not to touch anything else. I'm going to get this. And I'm going to measure it. So I'm going to measure the length of the wound. Just from here to here. I'm going to place here. Okay, so it's only about 4 in width. And then about 14 in that, and then in depth. It's about, I would say about 0.2 centimeters in all of those. And I'm going to throw that away. And then I'm going to open. Gosh, this does not work with my gloves very well. There we go. Okay, then I'm going to open my Q-tip. I'm going to use one Q-tip. And I'm going to use this to go around the inside of the wound and check for tunneling. If it was to tunnel, it would push in on one side of the wound in place. There's no tunneling. We're going to throw that away and throw these away. I'm going to take off these gloves and perform hand hygiene. So now I'm going to get my sterile filled ready. So I'm going to put this under his wound. Probably should have gloves on to do this. Okay. Make sure I don't get anything icky on me. And to keep him from the least amount of infection. Okay, so I'm just going to roll this up. My phone. And then I'll just let it go slightly. Make sure it's comfortable for him. That looks good to me. So I have him in a comfortable position where it's not showing anything for him and making him uncomfortable, but I also can see the wound really clearly. Okay, now, and then I'm going to get my dressing sheet ready. And at the very first, I would have asked if he had any allergies, if it was on any medication or anything, just to add that. So I'm going to pull this away from me, and I know that the first about half, maybe a centimeter, the edge is not sterile and all that. So what I'm gonna do, try to keep that. I'm gonna try to grab this without touching anything else, the inside of anything, and bring this out. And we're gonna try to do this and keep the field sterile, so we're not touching the inside of the gloves, just the outside part that we are able to touch. These really don't like me. Okay, now I'm going to grab the inside and pull these out. And I know that the first little edge right here on the edges is not sterile. So what I'm going to do first is I'm going to grab with my non-dominant hand and grab the inside of the glove. I mean my dominant hand. Apologize. Try to get my finger in here without touching any part of the outside glove to keep the sterile filled. I'm gonna grab here and grab the inside of this and try to make it easier to put my hand in. Just kidding, we're gonna change sides before I do that so that I have it on the right finger. Jeez Louise. Okay. Okay, now I'm gonna grab this, and it's sterile until I put down. So I decide what side to put down, which is not going to be sterile. So that side will not be sterile anymore. Now I'm going to grab this bag, toss that, doesn't need to be sterile. I have my hands up this entire time, not going below my waist and not turning my back to the sterile fill. Totally not reaching over the sterile fill. Okay. Now I'm going to open this and just have it ready for when I need it. Okay, now here's this, but since I already measured it, we won't need that. This is the bandage that we'll need. These are scissors. Here's our gauze. That is what we will put all of our name, date, and everything on. And I can touch the inside of this. Okay, but not the outside. Okay. So the first thing I'm going to do is open this, and I have 2 seconds. And I'm going to get that ready. Actually put the gauze in. We're going to put the majority of the gauze in, but we're going to keep probably about 2 or 3-ish out just to dry it off with. And I'll put those, I'll decide right this one. Fine. Pour that. Make sure there's plenty on there. And then make sure they don't turn right back to my sterile fill. So we're just gonna stay sideways. Okay, now we're gonna come over here and I'm gonna do one wipe. And we're gonna start, you start from top to bottom and then you go from inside to outside and you can wipe outside. So we'll go from top to bottom. And then I'm gonna put it in here. And gauze every swipe. Make sure I wipe the outside of the gauze and everything, and outside of the wound and everything with gauze. Okay, I'll do that with one swipe each. Okay, now what I'm gonna do is I'm gonna take off my sterile gloves, and I can put them in here. We're gonna get my, come over here, keeping my bodies in my sterile fill. I'm gonna get these gloves. Look at this. And then we'll hang it in after having that one. Do the next one. So making sure not to touch the inside where the gloves are actually at. I'm actually gonna move this over here so I have no room on the small table. I'm gonna open this up. I'm gonna keep these open. So now I'm gonna grab where the inside of the glove would be. They're really stuck together. Okay. Nope. Make sure I have it around the right way. Make sure to just keep touching the inside of the glove, not the outside where it should be sterile. Okay, now I'm gonna grab this one from, this is a little messed up, so I'm gonna grab this one and cut it from the outside because that is my sterile side. And put this glove on. It's not on the right fingers. There we go. Okay, now we're gonna come over here. Do not turn my back to my sterile fill. And I should have done this before, but we're gonna do it now. And we're gonna dry this. Put a new wipe for every dry. So we dry this to make sure the bandage sticks. It's completely dry now. Now we get the bandage. We're gonna put it on. So I'm gonna put this in the center of the wound and make sure there's an inch, all the way an inch towards the outside of the wound for the bandage. I'm gonna do this. Open the tape. And I'm gonna make sure this bandage sticks very well. I'm gonna do two just in case. Okay, and now I would put this, I'm gonna put this on there. And I'm gonna put the date, the time, and my initials to show that I did this. Okay, how did that feel? Was there any pain or anything in that? No? Okay, good. So now I'm gonna gather out my sterile fill. I'm gonna gather it like this to try to get all the gross stuff inside. Like this. Put this in here, and then I'm gonna get all of this and put this back. This is my biohazard bag. Since it totally fits in here. And I would, if I had a bigger biohazard bag, do my best to put it off. And go put it where we put our biohazard stuff at. Okay, now I'm gonna put these in the garbage. Hopefully that didn't have wasn't contaminated, so I could go in the regular garbage. Okay, I'm gonna put hand hygiene on. I'm gonna put more gloves on. Because I forgot to do this, but we're gonna do it now, so it's fine. Jeez Louise. And I'm gonna take this out from under our velvet garment, folding it so I don't get anything on myself or spread bigger. Now I'll go in our biohazard bag. Okay, now we're gonna make sure the patient's comfortable. How are you feeling? Is everything feeling good? Okay, I will come and check on my patient in about 30 minutes, and I will make sure that there's a dressing change done every shift, or at least checked. The dressing looks good, it's dry and everything. I'm gonna make sure he's at a low diet, make sure he's comfy. Are you comfortable like that? Okay, perfect. And then I would make sure I'm gonna go and try this.